Dr. Kagan, any thoughts?
Thank you, Jan. Thank you, Civitas. I'm going to switch gears. And I can't believe that the doctor actually read the bill and the lawyer didn't.
That's because you're getting paid and I'm not.
So I'm going to switch gears a little bit because I know that everyone has so far focused on the legal aspects. Obviously, I'm not an attorney. I'm a physician. I'm a surgeon. And I wanted to talk a little bit about this law, what it means, and I'm going to focus on two things. One, the bureaucracy that the law creates, and two, some of the penalties and taxes that are headed all of our way. And then I hope that even though I couldn't possibly cover the entire law in 5 or 10 minutes, that I have read it. I'm not an expert on it, but I will do my best to answer any questions you have from a medical provider standpoint. The goal of the Patient Protection and Affordable Care Act, which is really what it's called, is to provide affordable health insurance to all Americans while, theoretically, improving the quality and efficiency of health care. Well, let's talk a little bit again. Bureaucracy first, penalties and taxes second. I have identified in my reading of this law at least 9 new offices that will be created by this law. Let me just name a few of them for you, and I'll focus just on one. Number 1, the National Prevention, Health Promotion, and Public Health Council. Number 2, a separate Office of Women's Health. Number 3, the Shared Decision-Making Resource Center, whose obligation will be to disseminate best practices and patient decision aids. Number 4, a new Center for Medicare and Medicaid Innovation. Number 5, an interagency working group established and convened by the President to encourage collaboration among the following agencies: CMS, the Centers for Medicare Services, the FDA, the Department of Commerce, the Office of Management and Budget, the United States Coast Guard, the Federal Bureau of Prisons, the National Health Transportation and Safety Association, the Social Security Administration, the Federal Trade Commission, the Department of Labor. The list goes on and on and on. Number 6, the Federal Coordinated Health Care Office, which is supposed to coordinate Medicare and Medicaid patients. Number 7, something which is called MACPAC, the Medicaid and Children Health Insurance Program Payment and Access Commission. Number 8, the Independent Office of Health Insurance Consumer Assistance. And the biggest and best one, number 9, which is the one we all should be most fearful of, is something which is called MedPAC. MedPAC stands for the Independent Medicare Payment Advisory Commission. This is a commission appointed by the President without congressional oversight. And the goal of this commission is to reduce per capita Medicare spending. However, this commission has serious limits on what it can do. For instance, the law states it cannot recommend rationing, it cannot recommend increasing premiums, it can't modify benefits, and it can't change eligibility criteria. What's it going to do? It's going to cut payments. It's going to get payments to hospitals, it's going to cut payments to doctors. And what's going to happen, as we all know, doctors and hospitals are going to stop accepting these plans. Lastly, the President must submit MedPAC recommendations to Congress within 48 hours of receiving those recommendations. 2 days. And Congress, both the House and the Senate, the Act specifically limits their debate on these issues. So you now have an independent Medicare Advisory Commission appointed solely by the President that is allowed to make recommendations on, eventually, if we all get to 65, what we receive and how we receive healthcare services. So MedPAC is the one you really want to focus on. Other programs, there's a separate program to investigate postpartum depression, looking at a national campaign, public service announcements, to study the benefits of screening and issue a report to Congress. There's another program on personal responsibility education program to educate adolescents on abstinence and contraception. There's an adult preparation program. I thought that was our job as parents. To get our kids education, to teach them financial literacy, to teach them healthy life skills and, quote, stress management. $75 million allocated for that one. There's an elder abuse detection program in the law. And numerous other pilot programs, which I won't bore you with, but there's a list of about 15 of them. So now that I've got your blood pressure up, let's talk a little bit about some of the penalties you're going to get. So, there are penalties for taxpayers who are uninsured, as we've heard. There are penalties for insurance carriers not in compliance with government regulations. There are penalties for physicians and hospitals for not implementing electronic health records in a timely manner. There are penalties for physicians for not reporting quality assurance measures, and there are penalties for hospitals for not reporting quality data. Penalties, penalties, penalties. Interestingly enough, uninsured illegal aliens are not eligible to purchase insurance in the exchanges under any circumstance, even if they have cash. However, interestingly enough, those same uninsured illegal aliens are allowed to go to any emergency room in Raleigh, receive free care, and if they don't have a good outcome, they get sick.
Wow.
So let's talk about taxes and fees, and hopefully I won't upset your stomach. And there are a total of 13 of them. And I'm just going to go through them briefly, just to give you an idea, and hopefully encourage you, as painful as it is, to read this piece of legislation. It's going to take you a few weeks to get through it, but I would encourage everyone in this room to do it. And I won't enter into an argument with anybody unless they've read it. And that's how I start the argument. Have you read the bill? As soon as the answer is not, then we are not discussing it. Number one, there's a 0.9% additional Medicare payroll tax on any joint return over $250,000 or any individual return over $200,000. That one you're probably familiar with. Number two, there's a 3.8% tax on investment income on joint returns over $250,000 or individual returns over $200,000. That one you're probably also familiar with. You may not be familiar that there's going to be a 40% excise tax on, quote, Cadillac insurance plans. And that's defined as an individual plan over $10,000 or a family plan over $27,000. That affects a lot of folks. 40% excise tax. Obviously, we know about the individual mandate. I'll share with you a little bit about the employer mandate tax. Employers, they don't cover insurance if they have more than 100 employees. It's a complicated formula by which they will be taxed, either by a percentage of the number of employees who don't have insurance, or the number of employees who then obtain insurance through an exchange. And I can go into that in a little bit more detail a little bit later. The next one, number 6, there's a medicine cabinet tax. You're no longer going to be able to use your FSA or your HSA account to purchase non-prescription over-the-counter medications. The next, your HSA withdrawal tax is going up. If you need to take that money out of your health savings account to use for something else in an emergency, instead of being taxed at 10%, you're now going to be taxed at 20%. There's a 5% tax on all cosmetic procedures. There's a 10% tax on all indoor tanning. Doesn't affect me, but it's another tax. There's a 2.3% tax, and this is one of the most disturbing, on any medical device sold in this country over $100. As a vascular surgeon, I'm implanting expensive stents, expensive devices all the time. Every manufacturer, whether it's made overseas or in the U.S., if it is sold in the U.S., the manufacturer now has to pay 2.3% tax on that. Medtronic, as an example, the #1 medical device company in the world, had billions of dollars in sales in the United States last year. They make pacemakers, they make coronary stents, they make endovascular grafts to fix aneurysm. They have tentacles in every part of our healthcare industry. Next is an annual fee for health insurance providers based on the premiums they collect each year. There's an annual fee on branded drug manufacturers based on their percent of sales. And lastly, this is for people just going out and training, if you now receive your training and go out into practice, you now have to pay a $500 screening fee to participate in Medicare or Medicaid. And every 2 years, you're going to be re-screened. So, what's my conclusion? My conclusion is that I'm going to be arrogant and say that we, as physicians, are trained to diagnose, prevent, and treat disease. As you all know, a doctor and a patient develop a short-term care, develop a long-term care. We maintain specialty certification in our respective specialties. We maintain our continuing medical education credits. We do that in order to provide the best care possible for our patients. And my last line is going to be, there is no amount of government regulation that can replace a healthy doctor-patient relationship. I'm done.
All right.